Hello everyone. In this video, we'll be talking about keratoacanthoma. Keratoacanthoma is also known as self-healing carcinoma or pseudocarcinoma. So keratoacanthoma is a basically epithelial tumor of benign origin. It is a self-limiting epithelial proliferation which is having a strong clinical and histological similarities with the well-differentiated squamous cell carcinoma because keratoacanthoma histologically has presence of keratin pearls. So sometimes it can be confused with well-differentiated squamous cell carcinoma. So it arises as a cutaneous lesion from the infundibulum of the hair follicles. Intraoral lesions are rare. So coming to the etiology, the major factor which is responsible for keratoacanthoma is sun exposure. So sun damage can cause keratoacanthoma. Human papillomavirus 26 and 37 has also very important role. The other contributing factors are tar exposure, immunosuppression, burns, trauma and hereditary predisposition. Coming to the clinical features, it usually occurs before the 45 years and males are having a strong predilection for keratoacanthoma. So what we usually see, it occur as a 95%. In 95% we see it occur as a solitary tumors on the sun exposed areas. So keratoacanthoma mostly occurs on the sun exposed areas and 8% of all the cases are found on the vermilion borders of the lip. So as we know, as we have read, कि keratoacanthoma में the major etiological factor is sun exposure. So we usually see it on the sun exposed part. So it appears as a firm, non-tender, well demarcated, sessile, dome shaped nodule with central plug of keratin. So in the picture we can see, so it usually appear as a firm. If we touch the tumor, we will see it is firm in consistency, no pain. Okay, so well demarcated, and in the center of the lesion we can see a keratin plug, that is central plug of keratin. So outer portion of the nodules usually have a normal texture and color, but sometimes it can be erythematous. So central keratin plug is yellowish, brown or black, irregular clustered, often verruciform surface. So keratoacanthoma usually occurs in three phases. First one, growth phase, stationary phase and involution phase. So during the growth phase, so the name itself suggests growth phase. So in this phase, we will see rapid enlargement of the tumor with the lesion attaining 1 to 2 centimeter within the 6 weeks. So after growth phase, we see the stationary phase. In the stationary phase, the lesion stabilizes. And third stage, that is the involution phase. In this phase, the lesion regresses spontaneously within the 6 to 12 months of onset, frequently leaving a depressed area. So as the name suggests, it is a self-healing cancer. So initially we will see the growth phase where the lesion will grow up to a size of 1 to 2 centimeter in the 6 weeks. Then the stationary phase where the lesion stabilizes, and ultimately in the involution phase where the lesion regresses spontaneously, that is, it is self-healed. So we can see the lesion occurring on the lips. So this is the nodule, this is the tumor. So in the central area we can see central plug of keratin. The central area is often depressed. So coming to the histopathologic features, usually excisional or the large incisional biopsy is done with the inclusion of the normal adjacent structure, normal adjacent area. So excisional biopsy is done or a large incisional biopsy is done, and normal tissues are also included in the biopsy. The cells here appear as a mature. The important histologic feature here is dyskeratosis, that is abnormal or premature keratin production. So dyskeratosis means abnormal or premature, means time se pehle keratin productions we can see, and keratin pearls is similar to those seen in the well differentiated squamous cell carcinoma. So what is keratin pearl? So keratin pearl is a keratinase structure found in the region where abnormal squamous cells form the concentric layer. So in the photomicrograph we can see the concentric layers of keratin that is known as the keratin pearl. You can see in the arrow mark. So these are known as keratin pearl. So the surface epithelium at the lateral edge of the tumor appears normal. A characteristic acute angle is formed between the overlying epithelium and the lesion. So in the photomicrograph you can see I have given an arrow mark. So you can see the normal epithelium and the lesional tissue usually forms a acute angle type. So in the photomicrograph we can see, so keratoacanthoma mein, this is one of the characteristic features, that where the acute angle is formed between the overlying epithelium and the lesion. So the crater is filled with keratin and the epithelium at the base of the crater proliferates downward. So we can see in the photomicrograph the epithelium, the lesional tissue, it is going downward and we can see abundant keratinization. Okay. So pronounced chronic inflammatory cell response can be seen, and the later stage show considerably more keratinization of the deeper aspect of the tumor than to the early lesions. So basically what we will see in the histopathology, we will see an acute angle is formed by the lesional tissue and the normal structure, the normal tissues. So an acute angle is formed. We will see keratin pearls. We can see the lesional tissue proliferating downward, and we can see on the topmost layers, we can see overlying epithelium mein, we can see abundant keratinization, and chronic inflammatory cell infiltration can be seen. So here also we can see the epidermal proliferation downward with central keratin plug. So in the central areas we can see abundant keratinization. So that is one of the characteristic feature of keratoacanthoma. The adjacent normal tissue appears normal. So differential diagnosis, first differential diagnosis, it is squamous cell carcinoma, actinic keratosis or molluscum contagiosum. So coming to the treatment part. So keratoacanthoma involutes on its own. So that is why the name self-healing cancer. So as we have read earlier, it occurs in 3 phases. So in the later stage it involutes by itself. That is why no such treatment is required, but surgical excision of the larger lesion is indicated for optimal aesthetic appearance. So sometimes surgery can be done because of the aesthetic purposes. Okay, if you have liked the video, please do press the like button and please share it with your friends. Thank you.